Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective during the procedure. The nurse would not leave the child to speak with parents, while the procedure will be documented according to the facility's protocols. Proper monitoring of the client is the intervention most associated with reducing risks. The nurse is preparing to administer furosemide, Lasix, to a 3-year-old with a heart defect. The nurse verifies the child's identity by checking the armband and 1. Asking the child to state her name. 2. Checking the room number. 3. Asking the child to tell her birth date. 4. Asking the parent the child's name. The correct answer is 4. Safety standards require the use of 2 identifiers prior to medication administration. A parent can be used as the second identifier. Many young children will only answer to a nickname that does not coincide with a medical identification band or may answer to any name. It is common for children on a pediatric floor to go into each other's rooms. A small child may not know their birth date. A multigravida client thought to be at 14 weeks gestation reports that she is experiencing such severe morning sickness that she has not been able to keep anything down for a week. The nurse should assess for signs and symptoms of which the following: 1. Hypercalcemia. 2. Hypobilirubinemia. 3. Hypokalemia. 4. Hyperglycemia. The correct answer is 3. Gastrointestinal secretion losses from excessive vomiting, diarrhea, and excessive perspiration can result in hypokalemia, hyponatremia, decreased chloride levels, metabolic alkalosis, and eventual acidosis if precautionary measures are not taken. Ketones may be present in the urine. Dehydration can lead to poor maternal and fetal outcomes. Persistent vomiting can lead to hypocalcemia, not hypercalcemia. Hyperbilirubinemia, not hypobilirubinemia, is typical in clients with hyperemesis. Persistent vomiting may affect liver function and subsequently the excretion of bilirubin from the body. Hypoglycemia, not hyperglycemia, may occur as a result of decreased intake of food and fluids, decreased metabolism of nutrients, and excessive vomiting. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old primigravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following: 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies. When preparing a multigravid client who has undergone evacuation of a hydatidiform mole for discharge, the nurse explains the need for follow-up care. The nurse determines that the client understands the instruction when she says that she is at risk for developing which of the following? 1. Ectopic pregnancy. 2. Choriocarcinoma. 3. Multifetal pregnancies. 4. Infertility. The correct answer is 2. A client who has had a hydatidiform mole removed should have regular checkups to rule out the presence of choriocarcinoma, which may complicate the client's clinical picture. The client's human chorionic gonadotropin levels are monitored for 1 year. During this time, she should be advised not to become pregnant because this would be reflected in rising human chorionic gonadotropin levels. Ectopic or multifetal pregnancy is not associated with hydatidiform mole. Women who have molar pregnancies have fertility rates similar to the general population. The nurse is working with 4 clients on the obstetrical unit. Which client will be the highest priority for a cesarean section? 1. Client at 40 weeks gestation, whose fetus weighs 8 pounds by ultrasound estimate. 2. Client at 37 weeks gestation with fetus in right occiput posterior position. 3. Client at 32 weeks gestation with fetus in breech position. 4. Client at 38 weeks gestation with active herpes lesions. The correct answer is 4. Herpes simplex virus can be transmitted to the infant during a vaginal birth. The neonatal effects of herpes are severe enough that a cesarean birth is warranted if active lesions, primary or secondary, are present. A client with a primary infection during pregnancy sheds the virus for up to 3 months after the lesion has healed. The client carrying an infant weighing 8 pounds will be given a trial of labor before cesarean. The client with a fetus in the right occiput posterior position will have a slow labor with increased back pain, but can give birth vaginally. The fetus in a breech position still has many weeks to change positions before being at term. At 7 months gestation, the breech position is not a concern. A client in sickle cell crisis has been hospitalized during her pregnancy. After giving discharge instructions, the nurse determines the client needs further teaching when she states which of the following? 1. I will need more frequent appointments during the remainder of the pregnancy. 2. Signs of any type of infection must be reported immediately. 3. At the earliest signs of crisis, I need to seek treatment. 4. I have this disease because I don't eat enough food with iron. The correct answer is 4. Sickle cell disease is an autosomal recessive disorder requiring both parents to have a sickle cell trait to pass the disease to a child. Deoxygenated hemoglobin cells assume a sickle shape and obstruct tissues. Tissue obstruction causes hypoxia to the area and results in pain, called sickle cell crisis. This type of anemia is an inherited disorder. It is not caused by lack of iron in the diet. Self-monitoring for any type of infections or sickle cell crisis and increased frequency of antenatal care visits are part of the teaching plan of care. A client has just had a cesarean section for a prolapsed cord. In reviewing the client's history, which of the following factors places a client at risk for cord prolapse? Select all that apply. 1. -2 station. 2. Low birth weight infant. 3. Rupture of membranes. 4. Breech presentation. 5. Prior abortion. 6. Low-lying placenta. The correct answers are 1, 2, 3, and 4. Having the fetus at a negative station places the client at risk for a cord prolapse. With a negative station, there is room between the fetal head and the maternal pelvis for the cord to slip through. A small infant is more mobile within the uterus, and the cord can rest between the fetus and the inside of the uterus or below the fetal head. With a large infant, the head is usually in a vertex presentation and occludes the lower portion of the uterus, preventing the cord from slipping by. When membranes rupture, the cord can be swept through with the amniotic fluid. In a breech presentation, The fetal head is in the fundus, and smaller portions of the fetus settle into the lower portion of the uterus, allowing the cord to lie beside the fetus. Prior abortion and a low-lying placenta have no correlation to cord prolapse. A woman who is Rh negative has given birth to an Rh positive infant. The nurse explains to the client that she will receive ROGAM. The nurse determines that the client understands the purpose of ROGAM when she states, 1. ROGAM will protect my next baby if it is Rh negative. 2. ROGAM will prevent antibody formation in my blood. 3. ROGAM will be given to prevent German measles. 4. ROGAM will be used to prevent bleeding in my newborn. The correct answer is 2. ROGAM is given to new mothers who are Rh negative and not previously sensitized and who have given birth to an Rh positive infant. ROGAM must be given within 72 hours of the birth of the infant because antibody formation begins at that time. The vaccine is used only when a mother has born an Rh positive infant, not an Rh negative infant. ROGAM does not prevent German measles and is not given to a newborn. The nurse and the nursing assistant are caring for clients in a birthing center. Which of the following tasks should the nurse delegate to the nursing assistant? Select all that apply. 1. Removing a Foley catheter from a preeclamptic client. 2. Assisting an active labor client with breathing and relaxation. 3. Ambulating a post-cesarean client to the bathroom. 4. Calculating hourly IV totals for a preterm labor client. 5. Intake and output catheterization for culture and sensitivity. 6. Calling a report of normal findings to the healthcare provider. The correct answers are 2 and 3. The nursing assistant could assist the client with breathing and relaxation and ambulate the post-cesarean client to the bathroom. Removing a Foley catheter would also involve assessment of bladder status and totaling the intake and output and would be a nursing responsibility. Calculating the hourly IV totals for a preterm labor client would involve assessments that require nursing expertise. In and out catheterization, a sterile procedure, and calling reports to healthcare providers, which requires gathering and analysis of data, are responsibilities of the nurse. The nurse is planning care for a group of pregnant clients. Which of the following clients should be referred to a healthcare provider immediately? 1. A woman who is at 10 weeks gestation, is having nausea and vomiting, and has +1 ketones in her urine. 2. A woman who is at 37 weeks gestation and has insulin-dependent diabetes, experiencing 2 to 3 hyperglycemic episodes weekly. 3. A woman at 32 weeks gestation and is preeclamptic with +3 proteinuria. 4. A woman at 15 weeks gestation who reports she has not felt fetal movement. The correct answer is 3. The nurse should refer the preeclamptic client with 3+ proteinuria to a healthcare provider. The 3+ urine is significant, indicating there is much protein circulating. The woman who is 37 weeks gestation with insulin-dependent diabetes who has experienced hypoglycemic episodes in the past week can be managed with food and glucose tablets until the client can obtain an appointment with the care provider. The client at 10 weeks gestation with nausea and vomiting and +1 ketones should also be seen by a healthcare provider. But at this point, this client is uncomfortable, but her life is not in danger. The 15-week client would not be expected to feel her baby move as soon in the pregnancy, and this would not be considered a problem that requires immediate referral to a healthcare provider. As the nurse enters a room of a newly admitted prima gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. The nurse should do which in order of priority from first to last. 1. Call for immediate assistance. 2. Turn the client to her side. 3. Assess for ruptured membranes. 4. Maintain airway. The correct order is 1, 3, 2, and 4. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. Next, the nurse should turn the client to her side and then maintain the airway by keeping the neck hyperextended. When the seizure is over, the nurse should assess the client for ruptured membranes and the fetal status. A 77-year-old client is brought to the emergency department by her son. The client has severe headache and lack of sleep because I'm so worried about everything. Her son says that she has heart failure and chronic schizophrenia. In addition to all of her heart medicines, she is on aripiprazole, which was increased to 30 milligrams by her family doctor 3 days ago. In addition to documenting all the client's medications and exact dosages, the nurse should particularly investigate which of the following? Select all that apply. 1. The qualifications of the client's primary care provider. 2. The client's symptoms of schizophrenia. 3. The dose of aripiprazole. 4. The client's symptoms of heart failure. 5. The client's relationship with her son. The correct answers are 2, 3, 4. The client's symptoms are likely to be adverse effects of aripiprazole, especially at the reported dose. The normal adult dose is 5 to 10 milligrams. The elderly client commonly needs a lower dose compared with other adults. The anxiety and sleep disturbance could be symptoms of schizophrenia or medication adverse effects. A holistic approach would include assessing the client's heart failure. Questioning the qualifications of the family doctor is unproductive. There are no indications of problems in the client's relationship with her son. The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner, while adding that the medicine also will help, clearly and directly states the need for medication. Stating, God helps those who help themselves challenges the client. Stating, God wants you to take your medicine is deceitful. Stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.